What's up, guys? So in this video we are going to be going over the final portion of the neck release series. We're going to be going over the upper trap and levator. So the upper trap and levator, for those of you who don't know, are right here. So this is all considered upper trap. It connects up in here, kind of at the end of the spine of the scapula, and comes across, comes up, kind of at the back of the neck, up at the back of the head, all that fun stuff. I'm being super generic here, by the way. So we have all of this stuff, and then levator, if you find the corner of your shoulder blade closest to the spine, you find the really inside portion there, and you come up a little bit on top of that corner, and you can just kind of swim around the corner of that shoulder blade. And it should be more on top, but you'll find really tender portions of tissue in there. And that's where your levator connects to your scapula. The levator muscle connects there, comes up the neck, and attaches fairly high up into the neck, more on the lateral side than the posterior side. It connects to the transverse processes of the vertebra, so it's more lateral, less posterior. So more on the side, less in the back. Either way, that's the stuff you're going for. So we're going to be doing this manipulation with a barbell today. If you don't have a barbell, you can use a lacrosse ball. You can have your significant other use their hands. You can follow along with the video and even use a door frame if you want to. There's a bunch of different ways you can manipulate this tissue. So we've got a barbell today. We're going to take this lovely barbell. We're going to take the edge of the collar here, this raised portion, and we're just going to drop this SOB right on top of the meat of that muscle. So I'm using hands here to support pressure to find my sweet spot. Move it around and find the most tender spot you can find that's not just gonna totally be miserable for you. I want it to be uncomfortable, but I want you to be able to relax into it also. So we're gonna take this. First thing I want you to do is just wiggle that bar back and forth, whether it's forwards and backwards, whether it's side to side, I don't care. Just a small, tight little movement is one of my favorite ways to stimulate the tissue before we start really trying to do some work. Once we've done about 5 to 15-ish seconds of cross-fibery manipulation, we're just gonna let that weight drop into the meat, and then I like to take the barbell, drop it in, push it, or glide it back behind me, and it's sticking to the tissue. We're not sliding it, we're actually dragging the meat of the muscle back behind us and letting the weight fall down on it. From here, the cue that I like to tell people is sniff your opposite armpit. So you're gonna bring your head to the side and down until you feel a nice, intense pulling stretch where that barbell has the muscle pinned. Hold it for just a couple seconds, and then we come back, and then we do it again. We just go back and forth. Little pin and glide technique, kind of what we're going for here. And you can move this around however you want to make this feel the best for you. For some people, you just drop it on there and you go forwards and backwards. For some people, a side to side motion is gonna feel better. You can drop this thing on there and just move your head around in a circle and just move and manipulate all that tissue back there, however you want to. I suggest you leave this weight on this tissue for a minimum of 1.5 minutes, absolute minimum. Anything over 2 minutes is gonna do tremendously more for you, but I understand we don't always have that much time to do this kind of stuff. So do work with it however you can, as often as you can, to help correct these issues. If you can find the sweet spot that stimulates a sensation up the neck and almost into the back of the skull, that is the muscle / sweet spot that typically gives people the most issues. So if you happen to find that magic spot, hang on to it and then really try to focus just on that. Move around, open it up. So you'll do this on both sides. Don't completely kill yourself. And that is the final video of the neck release series. So thanks for watching, guys, and we'll see y'all in the next one.